Now we are going to dealing with infective arthritis. We have lots of arthritis covered in the previous video, so that it is the last video of the arthritis. So I am going to start regarding infective arthritis. There is it is like due to the caused by it is caused by microbial infections, microbial infections. And when we look like joint, like this is a I have just a rough diagram of the joint, and when we look the joint, it is like sterile, and there is no any organism. So from where this joint is infected, so when we look for the infection site, there is like hematogenous, hematogenous, hematogenous spread of infection. Like in the blood there is infection, so from the blood it's the microbes come into the joints, or there is direct inoculation, direct inoculation. Like if there is injury or any trauma, then that lead to the come inside the organism, inside the joints. Or another one is the contagious spread, contagious spread, like osteomyelitis, osteomyelitis. Like if bone is infected due to infection, if there is like in the blood vessel of the bone, and there is the organism in the from the blood, there is organism infection occur in the bone, and that leading to the osteomyelitis, and due to that there is also involvement of the joint. So there is like organism pass through the bone to the in the joint, and that lead to the infection in the joints. So there is rapid due to this there is a rapid destruction of cartilage at the joint, so that lead to permanent deformities, permanent deformity of joint and bones. So when we look, there is a suppurative bacterial arthritis, suppurative type of arthritis, or known as bacterial arthritis. In suppurative bacterial arthritis, it is like acute monoarthritis with purulent joint fluid, and there is like some causative agent, and their groups are divided. So I am going to summarize a table like group, and here is common pathogens. And when we look for like less than 2 years of the child's, these are infected by Haemophilus influenza. And when we look children, adults, and there is like bacterial that lead to the arthritis. These are Staphylococcus aureus. This pathogen lead to the in the adult or childs there is arthritis, bacterial arthritis. And if less than 2 years, there is a Haemophilus influenzae. And when we look for adolescent or young adults, in this condition there is like Neisseria gonorrhoeae is a causative agent. And when we look sickle disease, there is a sickle disease, sickle cell disease, and in this group of disease there is like organism like salmonella species, and this is the like bacterial suppurative. There is like clinical feature of the bacterial infection. So when we look for like clinical features of this disease, there is like sudden onset of joint pain. So sudden onset joint pain, swallowing and fever. Also there is restrictive movement of joints. And there is also like most common in bacterial arthritis, there is most common involvement of knees, and there is like gonococcal arthritis often after like after affect young women. When we look for the risk factor, so in the risk factor of this bacterial arthritis, so in the risk factor mainly IV drug user, there is like axial joint involvement, and there is immunodeficiency like trauma. If immunodeficiency trauma and complement deficiency like C5 to C9. This type of complement deficiency also lead to the bacterial arthritis. So for the diagnostic approach, like there is lead to joint aspiration, some fluid taken up from the joint cerebral, and this, if it is purulent fluid, so it is the bacterial organism. And so that gram positive gram negative donor culture stone identify the organism, and there is like some prompt like antibiotic given for the prevent the joint destruction. So antibiotic can given to prevent the joint destruction. Now we are moving on the mycobacterial arthritis. In mycobacterial arthritis, or TB, also known as TB arthritis, like it is a chronic monoarthritis from tuberculosis organism or by tuberculosis organism. So commonly spread from TB, osteomyelitis or hematogenous root. It is commonly spread spread of form of TB, from TB, osteomyelitis, or it's from hematogenous route into the joints. So in mycobacterial arthritis, there is most common involvement of some joints like hip joints, most, then knee joint, then ankles, like upper to descending, in the descending form, descending way. So when we look for the histology of the joint involvement, so in histology, when we look for the histology, in histology there is a granulomas with the caseous necrosis, granulomas with caseous necrosis, and there is also pannus formation going on. Pannus formation. In previous video we have discussed regarding pannus formation. There is inflammatory cytokines, and there is macrophages, lymphocyte are aggregation in the joints, and there is blood accumulation. This is called pannus formation, and pannus formation going on that lead to the cartilage erosion, and that cartilage erosion that leads to the fibrosis, ankylosis. And when we look for the symptoms of this disease, symptoms not that much given. Symptoms like there is gradual pain and swallowing, also systemic TB, sign may be present. This is regarding viral. This is regarding mycobacterial arthritis. So now we are moving on the viral arthritis. It's all about the Robbins pathology. So there is a viral arthritis. In viral arthritis, it is usually self-limited and symmetrical joint involvement. Like common cause of this, when we look for the cause, so there is like parvovirus B19, and hepatitis B and C. Also there is rubella, and Epstein-Barr virus, and alpha virus. This virus lead to this viral hepatitis, so viral arthritis, and there is some features of this arthritis, like acute and subacute onset, and there is its mimic age, rheumatoid arthritis, and due to the direct viral infection. It is due to the direct viral infection or post-viral infection, post-viral autoimmune response, post-viral autoimmune response. This is regarding viral arthritis. So now we are moving on the Lyme arthritis. Lyme arthritis. In Lyme arthritis, it is caused by Borrelia burgdorferi, and it is like a lockstick virus by Jodex tick, and there is late stage of Lyme diseases, and mostly cases are seen in New England and Mild West USA. So when look for the progression of this disease, there is 3 phases of progression. When look for the progression, there is 3 stages of progression, like 3 phases. First, initially early localized, then early disseminated, and then late disseminated. In early localized, we look, there is the skin rashes due to erythema migrans, and in the early dimsel there is a neuro and cardiac symptoms in neuro and cardiac involvement, and when late dimsel there is migratory arthritis. This is regarding the progression. So now we are moving on arthritis. These are the Lyme's arthritis features. So in the arthritis feature, there is mainly large joints involvement, like knee, shoulder, elbow, and ankles. In this order, there is like there is movement of joint to joint. So histologically, it resemble with rheumatoid arthritis, and for the diagnosis we confirm from the serology for diagnostic diagnosis. And there is chronic antibiotic refractory arthritis. Another one is chronic, not that much given, like chronic antibiotic refractory arthritis. Like in this there is autoimmune theory. In that is like response to Borrelia OSPA protein, and there is its mimic like post-treatment Lyme disease syndrome, mimic like post treatment Lyme disease syndrome. It's inside the, it's fall under the Lyme disease. So when we look for the comparative chart regarding this infective, so there is like type, here is type, here is pathogen, and there is involvement of joints and onset and special features. So in the type, if suppurative, there is suppurative, so there is pathogens like Staphylococcus aureus and gonococcus. So mainly involvement of the any or knee joints. And when we look for the onset, it is acute onset, and the special feature is the purulent material and severe pain occur. And when we look for TB or mycobacterial arthritis, so there is mycobacterium tuberculosis that involved in the hip and knee joint, and it is like chronic condition, chronic case. Onset is chronic. There is formation of granuloma, caseous necrosis. And when you look for the viral one, there is pathogen like parvo P19, hepatitis B and C. There is a joint symmetrical involvement, and there is the onset subacute. And when we look for the feature, it is self-limited, and rheumatoid arthritis like features. When we look for the Lyme, in the Lyme there is organism like Borrelia burgdorferi, Borrelia burgdorferi. There is a large joint involvement, and when we look for it is delayed type of onset. There is a migratory joint pain and rheumatoid arthritis like histology. This is all regarding the arthritis. So today we have covered all the topic regarding the arthritis. Medico, Medico Nepal.